Good morning, sir. Welcome to the day 2 of the conference. I am standing next to Dr. Bishnu Patra, sir, who is the HOD, Department of Orthopedics, AIMS Hospital, Bhubaneswar. Sir, how was the day 1 of the conference?
It was very fantastic. We started on time, and there were 3 live surgeries. All went very good, and all completed in time also. And the sessions went very descriptive, and we had a lot of discussions on each and every session. And to be fortunate, each session and the ending time was as per our plan. So there was also sufficient discussion, and we also finished on time. That also led us to have a good evening dinner also, and good evening get together also.
And what are the key attractions of this conference which has never happened before?
Yeah, first thing is this city is for the first time hosting this Indian Arthroplasty annual conference. So this is the first. That's the first uniqueness. Second thing is it's a good gathering. This is the number of delegates which have registered is maybe one of the biggest number of in the history of Indian Arthroplasty Association. Maybe the few numbers is this side or that side, but it's a very good number. And second thing is the level of participation and level of discussion and the level of surgeries and the participation by the delegate is really quite different. And we have also made something quite different, like the management of time. We have started 7:30, and that is too early for any conference. We thought that really there will be no people, but within 30 minutes the hall was full. So that shows the enthusiasm of the people, and that is the uniqueness of this conference.
Doctor, would you like to name some of the international faculties and the area of expertise or achievements?
Yeah, there are faculties from Australia, then UK, then US. Dr. Neil, he's Indian, he's settled in US. Then also there are faculties from Japan, and we have a lot of faculties who are very good. Around 8 international faculties are there. Yeah.
Doctor, as we know, the theme of this conference is simplifying techniques and technology. So, would you like to elaborate on this theme?
Yeah, basically, if I just ask you to give a small example, how do you like to wear a t-shirt? Just put your hands into it and make it as simple as possible. If I just put some multiple knots and so many things that you take at least 10 minutes to wear a t-shirt, that is complex. So similarly, our operations when we started were very complex. So our objective is to make it simple so that everybody can understand, and it can be done in very less point of time, the surgery, and the beginners can also operate with less of integrity. But if for example, if the technique becomes very difficult, like with some advanced computing mechanism, then everybody cannot access it. And if you take also phones also, if so many phones are there, very people who are not access to cannot see all the pictures of the phone. So what our objective is to make it simple so that everybody can use it, and at the same time we are having the same outcome and the same results also. Not that by simplifying we are decreasing the quality of the procedure. Yeah.
Doctor, would you like to talk about any particular technology?
See, now the era is of going for the line of robotic surgery, and to be fortunate enough, in Bhubaneswar also host 3 robots. And as I am from AIMS Bhubaneswar, we are in the process of procuring the AIMS robot also. But as you know that the money has to be utilized properly in a government institute. It's not like a private institute that have a different fund. In our institute, we have to look after how the money can be best utilized for the poor people, because many of the people reaching our hospitals are poor. So we prioritize our requirement. Like for example, a budget of 5 years, then we have to see what are the requirement which can be more purchased. But if you straightforward go for a robot and we don't have basic needs, so that's a dilemma. So what do we think that we are utilizing the funds very judiciously, and maybe very soon we will having the robot also that can also help the people in the city and also neighboring area, state getting the services from Bhubaneswar. Yeah.
Congratulations, Doctor, on taking Odisha to the forefront and organizing such a conference. Thank you so for your time. Thank you, sir.